this is Genita Mason. I'm the Medical Director for the Biosanctuary. In this video, I'm going to show you how to fill syringes with ozone. This is going to be a fun video for me because I am a very progressive healthcare provider, and anything that you are filling a syringe for is likely something that you're going to be saving a lot of money and doing for yourself, so long as you can do it safely and knowledgeably. And it's probably something very, very important that you need, okay? We're getting into invasive therapies here, and saying that, I need to say this. Anything I say here, any information I provide, I am not responsible for how you use it, okay? This is all on you. I am here to give you options, to show you how to do it. You choosing to do it is up to you. I do suggest that you check all the boxes, be very, very well educated about all of this, and also the safety checks. You can hurt yourself with intravenous ozone, so please keep that in mind. But I do know a lot of you could be, trying to find a way to treat yourself for something very serious that, could be very terminal, let's put it that way. And you can't afford to get into a clinic, so this is why I do this, so that you know how to do this. And sometimes, the risk of doing the ozone is kind of, balances out, what could happen if you don't do the ozone. So, and I understand that and I respect that. So anyway, but this is for information only. I'm not prescribing and I am not suggesting. I am neutral here. I am just showing you how we do it, okay? So that being said, so a lot of people, the first question is, when you're using a plunger, when you're using a syringe, how is it that you're getting exactly the ozone that you're selecting? Because you're pulling and you could be getting more oxygen or whatnot. Answers are very simple. You connect here, connect the output, of course, to the syringe. And we're all set to go. And remember, you want to have everything set and then turn the power on just as you're opening up your oxygen, okay? You don't want the chamber sitting there without oxygen flowing through it, all right? It can reduce the life of your equipment there. So anyway, here's how that's done to precision. I have everything set up. I'm going to turn my here to 7, and then this goes on and that's on. So now you'll see that you just let the syringe fill on its own, okay, to your desired milliliter, to the desired volume that you want of your ozone oxygen mixture. So you just sit there until it's done filling. Turn it off, and then turn your oxygen off, like so, and you're done. Now, let me explain a couple of things here about the application of ozone from a syringe. A lot of people use the syringe with a catheter or the bags. I don't use the bags or syringe. I go actually directly from the hose here to a catheter to the patient. Vaginal and rectal. Now, I'm used to ozone. I know how to assess my patients. I know what they're capable of, what they're not, this and that. But some people want to know exactly the volume that they're getting. So they'll use the bags or the syringe so they can measure their ozone oxygen volume. And that's fine. That's cool. So, that's one option, and then the option that I use. So remember that. Now, and also, by the way, when you're filling for the rectum, you definitely want to use the humidifier. So using the humidifier, because the ozone is a very dry gas, and especially people who are treating like IBS, where they're treating themselves like 3, 4, 5 times a week, in the colon with a dry gas, that can get tough on the colon. You can actually hurt the colon doing that with the dry gas standalone. So that's why you want to humidify the ozone oxygen mixture, and the way that you do that is you connect your output of the ozone generator to your humidifier, all right, and the output of the humidifier will go to your bag Or the catheter, okay? Catheter, you're going direct to the catheter, the bag, and the syringe. Now, these new silicone syringes are a little tight, and I have not personally done it. So, you know, I'm not sure that that's the best idea. If you're gonna do something that you need to hydrate and you're using it on the rectum, I would definitely just use the bag or go direct. Okay, much simpler, cheaper, better, faster. You know, and by the way, direct to rectum is usually 5 to 10 minutes at, you know, within the safety recommended potencies that are in the chart that I've provided. Okay, I think underneath this, the link is underneath this video. I think that right. Oh no, the big one here. So so this is a 5 milliliter glass syringe with a stainless steel tip. These are used for ozone therapy or any, you know, subcutaneous treatment that you need to do. You know, if you have a tick bite or something, you really want to make sure it's nice and clean in that area or whatnot. But mostly people use these things for ozone therapy. In fact, I had it done for myself years ago, about 5 years ago. I ripped a tendon on my mountain bike. So so the same procedure. You would, in fact, and it's a good idea to keep, you know, hydrated. You're going right into muscle tissue, joint, tendon tissue, so you want to hydrate it. Be kind to your tissues. You select your potencies, and you fill your syringe to the desired volume, okay? And then you would use a 30 gauge needle, very tiny, very thin needle to hit the joint. Now this treatment, you do need a nurse, okay? You need to don't mess around. You can hurt yourself. You know, the joints are very intricate, you know, area there, but you'll be saving if you're just paying a nurse, or you are, you know somebody who knows how to do it, then you're going to be saving a lot of money and having to go to a clinic to provide it, you know, especially the upscale ones. They get really, really, really pricey. But anyway, yeah, it's a 30 gauge needle and somebody that knows what they're doing. And you know, there's a lot of doctors that are going, you know, to this treatment as opposed to surgery because they're losing patients. It's getting so popular because it's so effective. Okay, so that's a big recommendation for joint and, you know, arthritic real hot spots in arthritic patients and whatnot. So anyway, so that's a quick introduction to what you can do with syringes. All right, this is Genita Mason, Medical Director of the Biosanctuary. Thank you for joining me for this quick series of, you know, how to treat yourself at home. Take care. Bye-bye.